My Lords, the justification for this statement and the Government's plan, repeated by the Noble Viscount the Minister, is that the level of claims have risen significantly since 2009, specifically mental health claims. Since 2009, we've had a global pandemic. The acuteness of the climate emergency has become obvious to everybody. We've had a cost of living crisis. We have a huge crisis of housing. Surely it's not a surprise that we have very poor levels of mental health across our society, and that's a measure of government failure rather than individual responsibility. And does the Noble Lord the Minister acknowledge that there are social determinants of health and that what we have to do is create a healthy society, which this statement makes no reference to? And also, does the government accept the social model of disability, acknowledging that the way in which society is arranged and organised is what truly disables people? And why is there nothing in this statement, not a single reference to what can be done to force employers, to push employers to actually provide appropriate arrangements for disabled people to allow them to continue to work, rather than focusing on the behaviour of disabled people?
Well, indeed, I know that we've had several sessions across the chamber. That's with me and the Noble Baroness Lady Bennet. And can I just say gently that for her to say that all the incidents of mental health that have propped up are purely to do with the decisions that government has taken wholly misrepresents the whole situation. She will know, as I think most of the House will know, that it's much more complex than that. And it's linked to all kinds of issues. For example, the rise in social media and the fact that perhaps more young people are on their phones is talked about a lot. So I think it's something which I may chide her on, to say that I think she might have mentioned that, for example. I think that it allows me also to say, to give one of the reasons why now is the time to look at PIP, and that is the very sobering figures that I've given out sort of slightly earlier, but I want to go a little bit further, which is that if we did nothing, over the coming 4 years, PIP spending alone is forecast to rise by 63%, from £21.6 billion, my Lords, to £35.3 billion, my Lords, and that would be for the period 2023-24 right up to 28-29. So it is not just about the cost, but it's, as I said earlier, I hope very fairly, that it's very important that we review PIP to be sure that it's directed in the right way, targeted at those who need it most, and it delivers the right sort of support for people with disabilities and health conditions, and also, as I said earlier, does provide better value for the taxpayer.